Greetings, my name is Dr. Del Webb, and we're here today to talk about why use medical insurance. Three main reasons: a new source of revenue, universally accepted documentation, and a huge increase in patient acceptance of your plan because they can have coverage through their medical. A check for $30,000, it says. I was invited to speak at the Perio meeting in Cancun a few years ago. And one of the doctors raised his hand and told the group that he had a patient who had tripped because of a change in her medications. She basically blacked out, fell, smashed her face. Check for the full amount, no deductible and no copay. Under major medical insurance plans, accidents, trauma are most oftentimes, no deductible, no copay, and the annual max is a lot more than $1,000 like your dental would have been. So trauma patients are something that you want to learn how to do and cross-code for the medical insurance because you get such a great reimbursement. 100% of your fee, no deductible, no copay, and lots of referrals. So whether it's the trampoline with the little kid, I had one doctor call me and ask me what the code was for a headbutt from a goat. I've had several, bicycles and baseball games and other things that they have codes for that you can be paid for. What types of treatment are payable for all of medical insurance? Trauma, which we've just introduced. Will it even pay for crown and bridge, etc.? Yes, if you have, as a result of trauma, you have that need and your diagnostic code fits that, then the answer is yes. Functional, like implants and TMJ and TMD, so that they can eat, so they can swallow, so they can chew, so they can speak. That's functional. We'll show you more in a minute. Pathology lesions are pretty straightforward and simple to believe. Related systemic diseases. New Jersey Delta Dental Association has a YouTube video where the person says there are 152 related systemic diseases that you can see represented in the mouth. I'd be hard-pressed to tell you what all 152 of them are, but that's the number on the video. Infection, when not treatable through the tooth. In other words, if you're going to do perio, endo, and oral surgery, obviously those would be payable. Speaking of TMJ, if you can get paid for TMJ, you can get paid for almost anything. What are the dental diagnostic codes related to TMJ? There are none. What about functional under medical? Look at 524.52, limited mandible ROM, range of motion. There are some dentists not even sure exactly what all that is, but they've had a code for that for a long, long time. You can be paid for that if you're doing the right stuff. How about number 2, CYA, universally accepted documentation. The need to document today is unquestioned. We have to do CYA in everything that we do. And at the Hinman meeting a few years ago, on the cover of their program, it had a triangle with 3 main points that they were going to discuss. And as you can read, evidence-based dentistry is something that is part and parcel of what we do today. The medical model, you have to submit a diagnostic code, you have to submit a treatment code, and therefore you've already created those codes, you've got them, you know what they are. Why not just submit it and get paid? 1 in 6 dentists, on average, get sued annually. Diagnosis, treatment plan, document. Best CYA that there is. How about number 3, patient acceptance? Well, if they can get the coverage for their dentistry above and beyond what your $1,000 would do, they'll be more likely to accept a bigger case, don't you think? For example, implants. Wouldn't it be fun to get a check for $15,000 instead of $1,500? In today's economy, patients are grateful for your use of their medical coverage. They'll help you do the submission. What about people who don't have the coverage at all? Wouldn't it be worth it to you to learn how to do it if you could get $3,000, $5,000, $30,000 instead of $1,000 annual max? Webdental.com. Notice there's 2 B's. It's my name. Or 1-877-628-3366. Thanks for listening. Come on over to the webpage and we'll see you there.